Every year on National Day of Mourning, we think about the workers that were killed at work and workers that have gotten injured or got sick because of a work-related incident. Today, I think most of us can't help but to think about essential workers because for the past year, those are the people that have continued to work during this pandemic. Anyone who left their homes to go to work were going to work every day knowing they might be coming home sick. I want to acknowledge and thank all those workers that kept our loved ones safe, provided services for all of us, keeping our communities going and protecting us. I want to take a minute to bring attention to a group of workers that are also essential, but have been at a higher risk of getting hurt or getting sick at work. And those workers are migrant workers. Migrant workers have been coming to Canada for over 50 years. Migrant workers live here, they work here, they pay taxes just like everyone else, the same tax dollars that pay to fix our roads, provide us access to health care, for schools, social services, but they don't have access to those things that they pay into. Migrant workers have very little rights and protections in Canada. There is very little to no accountability when enforcing health and safety protection on the farms or in the bunkhouses. When workers get injured on the job, employers want to send them home before proper medical attention. Once they are home, they can't work in their home countries, they can't provide for their families, and on top of that, a lot of times they are paying for medical expenses out of their own pocket for injuries or illnesses that happened here while they were working in Canada. Sometimes, I would say most of the time, these injuries or illnesses could have been prevented if their employer provided proper training, given them safety equipment, not used harsh toxic chemicals, and this list goes on. Last year, right here at a local farm, limestone was being used in the greenhouses. A lot of the workers started to feel sick. Their eyes were burning, their throats were burning, they had rashes on their skin, they were feeling chest pain, and the workers told the employer all of this and nothing was done. And one day, the workers just could not take the pain anymore, and everyone stopped working and asked the employer to stop using limestone. And the employer did. But because of that action, it resulted in many of the guys not being able to return back to work in Canada. A few months after this happened, management at this greenhouse spread even more limestone. This is just one example of what happens to workers that try to speak up.
Good morning, I'm Tashoy McCarthy. I'm an injured farm worker. I came here in 2014, December the 5th. I was working in this greenhouse for almost four years when I got injured on June the 28th. I was working in the packing house, in the packing area. I was packing some cukes, some quality of cucumbers. We finished those cucumbers and was going to go for some different grade of cucumbers. We call them the organics. So me and one of the co-worker there were cleaning down the machine. After they're cleaning down the machine, he accidentally bumped the lever. The lever caught the rag and pulled my hand in. My hand was in the machine, couldn't go back nor forth. It was in the machine for 15 to 18 minutes. They called for the maintenance. It took the maintenance a very long time to come to get my hand out. I was in so much pain. It's the worst pain I've ever felt in my whole entire life. At one time, my body was going in shock. Uh, they called for the supervisor. The supervisor, they came there. Um, Also was trying to get my hand out. The manager, they came. My hand was in, couldn't come out, was crushed. After the 15 to 18 minutes, they come and they pull down the head of the machine and they got my hand out. My hand was pressed right out, pressed right out. I thought like every bone in my hand was crushed, like squeezed right out. Blood even came from the tip of my fingers, squeezed without any cut or anything. Like blood was just coming through my pores. Butter blood was in the center of my hand and my fingers and the side of my fingers, bloodshot and everything. I couldn't move my fingers, couldn't use it. They didn't call any fire brigade, they didn't call the ambulance, they didn't call police or nothing. Anyway, the health and safety guy, which is Mike Nicholson, which is also the manager for the farm or assistant manager for the farm, he take me and he put me on the golf cart, take me up by the washroom where they have the ice and stuff. He get the ice, put it on my hand, and was there for a little while till he said he's going to take me to the hospital. I was in a lot of pain. He was even telling me how to blow, like he didn't want me to pass out because how I was feeling weak. My body was in shock. He was telling me how to blow properly, inhale and exhale, not to pass out. Anyway, he take me in the car and took me to the hospital. Going up there, I did a X-ray. They said there was no broken bone, no fracture. The doctor, Dr. Roberto Gonzalez, he just give me some prescription and he just send me back. Tell my manager that they want me to go back to work the very next day. To work same time, the same eight or regular hours that they wanted to work, which I couldn't. I was in a lot of pain. I explained to my manager and tell him. He was like, okay, if you're in a lot of pain, go back up to the hospital. I went back to the hospital. I see some different doctors. That's when they get a cast and wrap the hand in, and they give me some other medication which work, because the first medication that Mr. Roberto Gonzalez gave me have no effect. I was in a lot of pain. When I went on Monday, I think Monday was like July the 1st, where they give me some medication of Tylenol trees. Those work, take the pain down a bit, but I'm still feeling pain. They said they know like what the symptoms that I was having, like sign of nerve damage. I went to do a nerve test. They said there was no nerve damage. They said, as I said, no fracture, no broken bones. They put me to a specialty clinic in London where they said like it was soft tissue damage. So soft tissue damage was like the nerves, ligament, tendons and stuff. Yeah. Well, from then, I started even physiotherapy somewhere between August, I think was the end of July to August, and they cut me off physiotherapy for like 4 to 5 months. I started back to do physiotherapy in 2019 in February, down in almost the ending of February. Still here, still can't use my hand in 2019. No strength. I can push, I can pull, I can't use the hand. So like it's been a really rough time. There's no one. I tried turn to so many people for help. Tried to let my wife go up to the Ministry of Labor in Jamaica, where they were the one who got us on the program to come here in Canada to work. No help from them because I'm on the 2-year program. They call it the low skill program. So you have the 2-year program, the seasonal workers, which is from 6 months to 8 months. Those guys, they have the liaisons officer to speak on their behalf, because like I didn't even know, like once you're here and you're an immigrant worker, it seems like you don't have a voice for yourself. You can speak for yourself. You need is either a lawyer or someone to represent you. I tried to get so much help, and like there was none. I got to this set of people by Chris. I got to Chris Ramshram. They helped me out a lot with so much thing. Yeah, I thank God for their help. You know, the liaisons officer have been no help to me. They said I went to them. They said I'm on the 2-year program. They can't do nothing to help. You understand? So there's the system I think there need to be put in place for every immigrant worker, no matter what low skill, as long as you go through a process to come or to go to a different country, you understand, there's need to be something set in place that if you need help or if you're injured, there's someone there to help you, where you can turn to for help and who you can trust. You understand? As far as I learned, like there are Mexicans, Chinese, Indians, a lot of immigrant worker who are in almost the same problem as I am now. Really, no one to really turn to. But
There's been COVID-19 outbreaks at farms across Ontario. Some of these farms have had multiple outbreaks since the start of this pandemic. There has been thousands of migrant workers who have been tested positive, and the provincial and federal government has taken little to no action. One action they did take was provide funds to the employer. But still, it's not enough to protect the workers. They need to take immediate action in protecting them and to hold their employers accountable so that the responsibility does not fall on workers who have been made vulnerable by the system that brought them to Canada.
As an immigrant worker in Canada, well on my side, it's not really good, because from last year I've been going through so much at this farm where I work, because first my hand was like really wash up bad, then my skin get wash up really bad, because first it was the cucumber leaf that was causing my hand to break out in rash, then the dust in the field. Yeah, and in January I get a injury in my back by an ex-co-worker, and these people don't care about it. They didn't care about it. They just, instead, these people try to make me feel better as a worker. They are planning to send me home anytime soon. So yeah, it's really rough. These people don't give, I don't know how to say it, but this as an immigrant worker in Canada, it's not going well for me. Yeah.
Workers have said that there are many cases of COVID at their workplace, yet their employer have either refused to disclose this information or they have taken steps to protect themselves through quarantine while forcing their own workers to continue reporting to work. Some workers only learned of COVID positive cases in their own workplaces from other workers who tested positive. Some workers do not know their COVID status because their employers have not allowed them to get tested if they are not showing symptoms, or else have tested them and have not informed them of their own test results. Many workers are working without knowing whether they are COVID positive. Multiple workers spoke of a lack of appropriate COVID-19 protocols, both in their workplaces and in the shared accommodations provided to them by their employers. A lot of workers cannot social distance and work in close contact with other coworkers who later tested positive for COVID. At their bunkhouses, multiple people share bedrooms, kitchens, and bathrooms. Some report dozens of people using common spaces without appropriate sanitation. Workplace protections must go beyond PPE, as employers are still not taking appropriate measures to sanitize workplaces and are putting the onus on workers to take responsibility for COVID outbreaks, rather than addressing systemic workplace issues. This has created a stressful and toxic work environment where workers are concerned for their health and for their jobs if they are believed to violate workplace policies. One worker reported that they were given a warning when they refused to re-wear a dirty mask. Other farm employers provided almost nothing at the beginning of the pandemic, forcing workers to rely using their own money for PPE. The disinfection process used in some of our greenhouses are not safe to work within, and yet a worker stated that they were made to return to a freshly sprayed greenhouse and breathe unsafe air. This is what's happening right now. April 28th is National Day of Mourning. April 26th, a couple days before National Day of Mourning, I found out 2 migrant workers died at 2 separate workplaces. As I'm recording this right now, workers are leaving their home countries, coming into Canada, knowing about the horrible living conditions, the unsafe workplaces, and not knowing if they will ever see their families again. Workers all deserve to feel safe and know that at the end of the day, they can go home to their families. Today, let's remember all the workers that died here, but let's continue to make sure we hold this government and the employers accountable when they don't put the health and safety of workers first. Today, we honor and remember the dead, but tomorrow we fight. We fight for the living.